At the end of this month, nearly 500,000 New Yorkers, including 9,000 right here in Onondaga County, will lose their health insurance because of federal cuts. Lawmakers push Albany to act. The state budget passed without a fix. NCC News reporter Matthew Davison has the story. Matthew?
Danny Miguel, thanks. These are people caught in the middle. They have jobs but earn too much to be eligible for Medicaid, but don't earn enough to afford what comes next. I spoke with some of the affected residents earlier today.
They need to thank God that they're not in this situation.
After suffering a stroke last September, Liverpool's Terry Felt was put on the Essential Plan, free insurance to cover her medical costs. But as of July 1st, she'll have to find a new plan.
The other plans I've looked into are running about $600 a month. Who can afford an extra $600? But who can afford not to when, they've had these health issues going on?
Felt is one of nearly 500,000 New Yorkers losing coverage under the Essential Plan. Federal cuts dropped the income eligibility threshold, and the state budget, signed May 28th, passed without a fix.
This is one of those cases where the state government is trying its best to minimize the impact.
Public policy professor Sarah Hammersma says the impact will be felt across central New York's healthcare system. Hospitals are required to treat patients regardless of their insurance status, but when patients can't pay, the financial burden falls on them.
They need to take care of people, and then they have to figure out the money later. And what that means is, in some of these cases, the money just won't be figured out later because there isn't any insurance to draw on.
Affected residents have until June 15th to enroll in a replacement plan if they want coverage to start July 1st without a gap. And we received an update just a little bit ago from the New York State Department of Health. They say they are providing personalized guidance to those impacted. And they also said, though you should apply for a new insurance plan by June 15th, they're actually extending that deadline to August 1st, and they'll apply insurance plans retroactively. For now, I'll send things back to the studio. I'm Matthew Davison from outside Crouse Hospital.